So in this video, I'm going to show you a little bit about the angle that we want to achieve when baby is latching in a cradle or a cross cradle position. So the very first thing that you want to be able to see with this position is that you are going to get into a really comfortable position first. So if you're sitting up, you want to lean back as far as you can. You want to make sure that your body is very well supported, you're in a good posture, and that you're comfortable, because the more comfortable you are while you're doing this, the easier it is going to be to continue to stay in this position. The more likely that baby is going to be able to find a good spot, and you guys are both going to be able to enjoy this position the most. So I do find that cradle and cross cradle can be a very difficult position for newborns. Especially if we are working with any type of, maybe oral restriction or tightness in the mouth or things like that, it can be a very difficult position for them to do. And I want to show you why. So basically what you want to see is that baby is going to be able to achieve a really nice deep latch. The majority of where their latch is going to be will be at the bottom part of the jaw, and the nipple will be angled toward the roof of the mouth. When that is happening, it's going to actually be able to help remove and compress the milk in a way that is really efficient. The tongue is able to use all of the motion that it needs to. When you're in these type of positions leaning forward, a lot of the time we're kind of hunching over and doing that mom posture, and babies are actually going to have milk coming directly into their throats. If you have a pretty decent supply, they might have a little bit of a harder time with the letdown. They could be coughing and sputtering a little bit. And this is one of the things we want to avoid. The other thing too is, as there's an angle, so if you can imagine from this angle, a lot of the time what happens is baby comes on and they're using a lot of the mouth muscles to just keep that breast from going away. So they're really using a lot of their mouth muscles to hold that nipple in place, rather than being able to get a really nice deep latch. So this can increase clicking, this can increase like suction loss, which actually gives more air into the belly and can make babies gassier. So there's a few different benefits for being able to kind of get yourself back, get yourself comfortable, and be in a position that's going to actually allow baby to come onto the breast from up above versus having to kind of like hold on to the nipple from down below. So to actually see that, what we want to do is bring baby's hand underneath the breast. We want them to be belly to belly, so their ear, shoulder, and hip are lined up, your belly button to belly button, and everything is going to be in a line. The other thing that you want to make sure is that you're bringing baby to the breast. You're not bringing breast to the baby. So this is going to have them up in a nice high position so that they're not kind of underneath and trying to put their head up and look for that nipple. You're going to bring them up and make sure that you're sitting there. If you're using a breastfeeding pillow, you can stack it up underneath and then pop a blanket or other pillow underneath, depending on how much height that you actually need. So what you want to see is, ideally, baby is going to come and their bottom hand is going to be placed underneath your breast. Depending on how you're going to start this position, which a lot of people start upright, what you want to see is that baby's head is not going to come on directly to the nipple. So what that would look like is basically baby is going to come right straight at it. What we want to see actually is that baby is going to be kind of looking up and coming up to the nipple instead. So what that would look like when it comes to latching is baby is kind of here, and most people have them lined up so that baby is actually looking into the armpit. What I want to see is that baby is actually looking up so that their head is kind of, their nose is in line with where the nipple is. This is actually going to change the angle so that baby is facing up and looking up in that sniff position, and is going to give just a little bit of extra room for them to be able to have that kind of open swallowing of the neck. The other thing too is, if you do notice that baby has, moved over, or if you have sat and kind of got comfortable and it adjusted, you can use your arm, the opposite arm, and just pull baby's body in just a little bit. So you put the pressure kind of along their bum, and that will actually help to move and it will change the angle of where they're going to be sitting. So it can just move just a tiny little bit just by tucking that little bum in, and it changes the shape and the position where they're laying. Hope this helps.